Well, have a seat. Well, you look like $1 million, that's for sure.
I feel marvelous.
So you're 18 days into this mission.
Yes.
When did it kick in? What was the biggest shift that you felt from the very beginning?
Well, I think my biggest relief was after the third night, I started sleeping 5 to 6 hours without a disruption. I hadn't done that in literally 12 years. And because of that, all of a sudden my energy shifted during the day. I didn't wake up feeling like I was ready to go to bed already. And that energy level has stayed constant throughout the day. So, Dr. Hall, is this typical? I mean, when you see the levels as off balance as they were, is this a typical response?
Becky presented as a very typical patient. Her estrogen levels were only 45, and I would expect a lot of muscle aches and body aches. Frequently, people think that they have fibromyalgia or chronic fatigue. They're so tired, depleted. They have a very low sex drive. So Becky was actually a perfect woman to treat and to replace her hormones with.
And you know what I hate is that Becky suffered 12 years before she got to see you and have some relief. And I think a lot of women out there suffer and think it's something else or think it's normal. They think this is just part of getting older and it's part of life. And so I'm sad that you had to suffer for 12 years, but how wonderful that it turned around so quickly.
Absolutely.
Yeah. So this is your husband, Brian. So you've got the old Becky back. And what are you going to do with that?
I'm going to have to go on a diet.
I echo what Robin is saying. And I mean, for all of you out there, there's something that can be done about this. Now, coming up, we're going to meet a woman who says she's angry, tired, lazy, and she feels that she's less than a mom. She's only 33 years old. We'll talk to her when we come back.
I am downright exhausted. I'd rather just sit on the couch. I'm very moody. I flip off and on very easily.
A little bit snappy with our daughter. We're not intimate together because we're constantly bickering back and forth.
Dear Robin, thank you. I had a hysterectomy this month, and I found a compound pharmacy with a very supportive staff. The bioidentical hormones they put me on are amazing.
I've had menopausal symptoms for years. It just didn't take the time to think about me. I was watching a show, and you were talking about hormones and that they were like having a zest for life. I immediately called my doctor and got all my hormones started.
I've been through it all. I just would not take the doctor's suggestion and just live with it. After watching the show, I began taking the testosterone along with the progesterone. I finally have my sex life back. I thank you, and my husband really thanks you.
Well, today we're having a very straightforward conversation about menopause and what women can do to manage their symptoms while getting support from their families and friends. Now, as Robin has expressed many times, and also in her book, What's Age Got to Do with It?, this period in a woman's life doesn't have to be something they dread.
Studies have shown that women can start experiencing perimenopausal and menopausal symptoms even in their 20s and 30s, as is the case with our next guest, Michelle. She says she wanted to get her hormones tested for years, but her doctor said she was way too young to worry about that sort of thing. After reading her letter, I sent her directly to meet Dr. Prudence Hall of the Hall Center. But first, let's take a look at her story.
Robin was talking about her hormone issues, and I started realizing that a lot of the things that she was saying matched what I was feeling. I am downright exhausted, whether it be cleaning the house or playing with my daughter. I would rather just sit on the couch.
She really mopes around the house quite a bit, a little bit snappy with our daughter.
I started noticing the symptoms when we started trying to have another child, and I realized that I couldn't get pregnant. It was kind of a chore to actually try to get pregnant.
We're not intimate together because we're constantly bickering back and forth.
I'm very moody. It affects the relationship with my daughter a lot. It's very heartbreaking to me to have her come out and say, "Mommy, I want to play with you," and have the response be no. I want to go back to being me.
Michelle, it looks like we have two goals. One is to feel well, and the other one is to get pregnant. How long have you been feeling this way?
I probably started noticing it about 5 years ago. Within the last couple of years, it's gotten worse. Everybody kept telling me I was too young to be going through perimenopause.
It's really frustrating for women to be told that they can't have a hormone imbalance. And I see hormone imbalances in young women as young as 13 and 12. As I'm looking at your labs, I'm seeing a number of imbalances. See, this curve here is the female hormone.
Okay. On day 4, your estrogen should be 150. Then on day 8, 250. Now, your level was 118. This is really quite an estrogen deficiency. So how do you feel about that?
Somewhat scared about it. The fact that I'm 33 is kind of a strange feeling.
We only use bioidentical hormones. They are exactly the same hormones that your body is creating. We're going to be able to offer a lot of support and help. I think you'll feel much, much better. Okay?
Great.
Well, our cameras caught up with Michelle the other day since her visit to the Hall Center just 2 weeks ago. Take a look.
Since I've seen Dr. Hall, I've been feeling much better. The thing I noticed right away was my mood. I'm just laughing more. I'm happier.
She's smiling more. She's just more her old self.
I have a lot more energy as far as my daughter's concerned.
Michelle is playing with Kaylee more. They play with their Barbies and the horses.
I'm starting to sleep better finally. When I went to the gym yesterday, I was able to sail right through the sparring session with no problems. Robin, I want to thank her, because if it wasn't for her, I would never have realized what my doctors had been telling me all these years was wrong, and that I could have a hormone problem.
Her sex life has definitely improved. A couple times she's kind of jumped me.
That is great news for Michelle. So let's see, Michelle. Come on out. I love hearing all that.
See you. Have a seat. So you were surprised that you were so out of balance at such a young age.
Right. I have been told for years that I'm too young and I can't have hormone issues because of my age, and so I started beginning to think that it was just me and that there was something else wrong. And then I saw Robin, and she was listing off all of her symptoms, and I'm going, wait, check.
I think she's a good example that you don't have to be in menopause to be suffering from a hormonal imbalance. It can truly start in your 20s and 30s. Is that not right, Prudence?
That's right. I see many, many patients in their mid-30s to late 30s who experience perimenopause. And in women's 40s, I would say that most women are perimenopausal.
Okay, now we keep talking about testosterone in women, and most people think about testosterone with men. Explain why that's so important for women.
Well, testosterone is an important hormone in women's because it should be at a level of 50 to 80. And when it's at a nice level like that, women build muscle, they feel positive about life, they feel energetic, and it really allows women to feel very positive about their life.
So it should be like 50?
50 to 80, 50 to 100.
Yours is like 390 or something? Just kidding.
No, but really, it will allow your skin to not wrinkle and to not dry out your hair. There are a lot of great side effects of supplementing testosterone.
Okay, now you were told by Dr. Hall that you wanted to take bioidentical hormones, right?
Right.
Okay, now let's talk about that just real quickly. Why bioidentical hormones instead of, I guess, synthetic hormones? What are bioidentical hormones?
So bioidentical hormones are the exact same hormones that a woman is making in her own body naturally. And what we do is we replace that hormone to a normal young level. So the synthetic hormones are hormones that come from pregnant horses or from plant sources, and they don't mimic. They're not the same hormones that our body is naturally making. So we can't improve on nature, really. We're just replacing the hormones to a youthful, young level.
So bioidentical is a more natural.
Definitely more natural. It's the
okay.
same hormones that a woman is making naturally.
Right. So Mark, how's she doing?
Dr. Phyllis is doing a lot better. I've got my old wife back, which is a great thing.
Yeah, are you in trouble less often?
Much less often, yes.
Okay. So it's good. Have you noticed a mood shift as far as your interactions with Mark?
Yeah, definitely. Within a couple of days, I started realizing I wasn't biting his head off as much, and he wasn't annoying me as much. So that's nice.
Okay. All right. All right. You're welcome.
Thank you.
You want to shake her hand for sure.
Thank you.
All right, coming up, do men really suffer a midlife crisis? We're going to find out the truth behind if there's such a thing as male menopause when we come back.
I wondered what happened to my libido, so then I thought rather than seek antidepressants and ED medications, where should I be for a man who's my age?
Today, we're talking about the realities women face when it comes to balancing their hormones. Arming yourself with information is key, and becoming an advocate for your own health is something that has helped me embrace the sometimes not so pleasant symptoms of menopause.
Well, you guys out there, don't think you're out of the water on this hormone thing. Studies have shown that testosterone decreases in men by approximately 1% each year after age 30. Now, I hope our section of men here today are listening closely to this. My next guest, Howard, says that he used to feel like a lion. His words, not mine. And there wasn't anything he couldn't take on. But now he feels depressed and sluggish, like a piece of fruit that's being squeezed.
When I look in the mirror, I don't see an attractive man. I see a man who is full of failure and doubt. I believe I'm suffering from male menopause. The depression, the lethargicness, kind of like a needle on the record needs to be changed. In my 30s, I was able to burn the candles at both ends, and there never was a problem. I started noticing there was more fat and less lean muscle. I'm not able to concentrate on things as well as I did before. My functionality as far as sexual seems to have waned quite a bit. I went to my physician, and I was told that my testosterone level is slightly lower than that of a male 85 to 99.
Dr. Howard Leibowitz from the Hall Center specializes in male hormone decline and immediately met with Howard.
Hello, here to see Dr. Leibowitz?
Yes, sir.
Do you have any issues with sexual function or sex drive, libido?
Absolutely. That has been the most devastating thing.
Male menopause is when men's hormones start to decline, and it usually happens in their 40s or 50s, and it's very gradual. It's primarily the decline of testosterone. Zero sex drive?
Yes.
They generally experience lack of enthusiasm, decrease in energy, strength, muscle aches, low sex drive, loss of zest for life. They tend to be more irritable, grouchy, things like that. Your testosterone level here is 347. The reference range is 211 to 827. So I would recommend about 550.
I'll do 800 if you want.
All right, well, Howard says that he noticed a change in how he was feeling within the first 36 hours of visiting the Hall Center. Take a look.
When I started taking the supplement, I started to feel like a little motor was going on inside of me. My energy has definitely gone up through the roof. Before, I was feeling sluggish, and now I'm feeling more zest. Everything's looking fine. The numbers are really looking good right now. Brain feels a lot sharper. Feels like I'm thinking a lot more like I did back in my 20s. I feel a lot stronger now than I used to feel. I really want to thank Robin for making this possible for me. And I think it's wonderful that she's taking a look at the man side of it, too.
Okay, so 36 hours you started feeling a difference.
Absolutely.
So what did you notice first?
I'm feeling less tired, a lot more zest for life, less sleep's required too.
Yeah. Now, Dr. Leibowitz, we've got sections of just all men here. What's the percentage of guys in this group that are likely to be experiencing this kind of thing if they would just have it checked?
Well, it depends on the age group, but generally men over 30 can have a hormone decline, and it's very much overlooked. And I really acknowledge both of you for bringing this to public attention, because men do get overlooked in this.
So, what you said, it's affected your skin tone, your energy, virtually everything.
Yes, snap decisions are much easier to be made. I can do things quite quickly and clearly.
Well, I mean, that's a huge impact. I mean, do you typically see this kind of reaction?
Yeah, testosterone has so many benefits for men, and it's really gotten a bad rap because it gets abused by athletes, and you see it in the press and things like that. And a lot of people are afraid of testosterone, but testosterone generally makes men healthier.
All right, next, we'll meet an emergency room physician who admits that doctors may not always know everything. We're going to hear her story when we come back.
You may ask, what are bioidentical hormones? Bioidentical hormones are hormones that are exactly the same as what your body's been making your whole life. Now, since the formulas are not commercially available, we're customizing or compounding these particular prescriptions. The end result will be prescriptions that have been personalized for each individual's needs based on their doctor's orders.
We're talking about managing the symptoms of menopause for both men and women. Now, that was Jim Hernser,